All right, so I'm going to be talking about my applied practice experience. This is ABRAR BARDESI for those who don't know me. I'm a third year preventive care student. So the public health issue I was tackling in this applied practice experience is improving chronic illness in patients visiting a primary care clinic here in Palm Desert, where I live. So some statistics regarding chronic illness in the US, almost 6 out of 10 adults have at least one chronic illness. So it's very prevalent. And we can say it's the leading cause of morbidity and mortality in the United States. And moreover, it's costing the country $4.1 trillion annually in healthcare. Some examples, as we all know, include heart disease, cancer, hypertension, and obesity. So according to the literature, one's lifestyle greatly affects the degree of their health. There are 4 main lifestyle behaviors that are contributors to chronic illness, according to the CDC. First is using tobacco, which is mainly in smoking. We all know that smoking damages almost all of our body organs. And let's not forget the effect of secondhand smoking exposure, and that can contribute to chronic illnesses as well. The second factor is poor diet, which includes one that is high in processed foods like sugars, salts, and saturated fats. Also, the increase in portion size and caloric input can lead to overweight and obesity. Third factor is lack of physical activity. So even for those without any other risk factors, lack of physical activity can result in heart disease and other chronic illnesses. The last factor is excessive alcohol use. We know that drinking too much alcohol can cause high blood pressure, heart disease, stroke, and other problems. So I want to talk about lifestyle medicine in the sense that it's a specialty that uses therapeutic lifestyle modifications to treat chronic conditions. Certified practitioners in lifestyle medicine are taught to use evidence-based whole person prescription lifestyle modification to treat such illnesses. So if these modifications are employed in an intense and frequent manner, it will result in a chronic illness reversal eventually. So the 6 pillars of lifestyle medicine are healthful eating, physical activity, managing stress, avoiding risky substances, quality sleep, and having healthy relationships. So what's the role of healthcare providers? It's been increasingly finding that they need to be proficient in the ability to offer patients chronic disease appropriate lifestyle counseling. So this includes educating patients on the significance of these healthy behavior changes. But the real challenge is motivating the patient to permanently change their lifestyle, which is, hard. Teaching the patient about the impact of lifestyle choices on health is one thing. However, healthcare professionals should be prepared with the resources that can assist patients improve their health-related behaviors by tapping into their innate desire. Also, it has been demonstrated that collaborating with the patient to define short and long-term goals and objectives and regularly checking in with their progress increases the likelihood of preventing and controlling these chronic diseases. So it's a whole process.
Wow.
So here's a little background of the organization I worked in for this supply practice. It's called Palm Desert Urgent Care, which is a clinic run by Dr. Kazi, who is an internal medicine physician. He focuses on primary, secondary, and tertiary preventive measures to treat and maintain health. So he does, of course, prescribe drugs, but he devotes around 2/3 of his appointment discussing lifestyle behavior change. So some of the things that I've observed is that he encourages patients to improve their diet, exercise, coping with stress, quitting smoking. So attending the clinic provided me with the opportunity to see, the theoretical concepts that we learned in preventive care being put into practice. So the initial stage, as I mentioned, was observing Dr. Kazi's interactions with patients who are receiving lifestyle counseling. Then I sat with patients alone, and I provided one-to-one lifestyle counseling as needed. So yeah, that's the goals and objectives of this applied practice was to give counseling to patients in a clinical setting. So the objectives included educating patients regarding the effect of diet, physical activity, stress, sleep, and other lifestyle behavior on the prevention and treatment of chronic diseases. Another objective included motivating patients to change their lifestyle habits in relation to their chronic illness. Also, helping patients set SMART goals to change health-related behaviors, such as improving diet, increasing exercise, and the like. So for the project population, inclusion criteria included adult patients 18 years or older who have at least one chronic illness, such as diabetes, heart disease, or are at risk of developing chronic disease, such as those who are overweight, pre-diabetic, smokers, have poor diets, high cholesterol, and etc. So the main activities for each patient encounter, it was comprised of inquiring about the 6 lifestyle pillars, then making appropriate lifestyle recommendations in according with the patient's needs. And then, of course, the most important part is encouraging patients to make steady and incremental change and drawing from their values and principles to motivate them to continue. So here's an example of one of the patients I saw. She's a 56-year-old female who was diabetic, HbA1c of 6.7. She was overweight, had osteoporosis, high blood pressure, hypothyroidism. When I asked about her exercise history, she's mostly sedentary. She says most of the time rarely engages in any, physical activity. She reported that she had frequent stress and fatigue. She's always worried about her health, and she takes care of her autistic son, so this is causing her lots of stress. In terms of social relationships, she had a close knit community of family and friends, and she can lean on and, socialize with them. So this is pretty good. In terms of diet, overall, she seemed to eat sufficient number of fruits and vegetables. However, she eats red meat and rice almost every day. And she enjoys frying her food with vegetable oils and eating desserts weekly. So for the lifestyle counseling part, in terms of her diet and exercise, I gave her general education regarding balanced eating, the importance of exercise and stress management. Then the patient was asked about her values and what she believes is important in her life. So she stated that she would want to live long for her to be able to continue supporting her family. And after further discussion, she decided to start doing simple changes like walking once a week for 10 minutes with her husband. Also, she wanted to try swapping out one meat-based dish for a vegetarian choice, so just once a week. When we discussed potential menu items that she and her family would like, she brought up a traditional dish made of legumes. So this was important that she had something in mind that they can actually enjoy. And, they have a plan to actually implement whatever we discussed. So talking generally about the patients I saw, some of the most common health habits among this population was eating processed foods from ready-made frozen meals and, that come from supermarkets and restaurants. So patients were educated about the difference between whole foods and processed foods. This was shockingly new to some patients. So, I introduced whole foods such as real, foods that come out of the ground, such as fruits, vegetables, whole grains, and then processed foods like anything packaged or most of the sweetened beverages. I also shared resources about reading labels and how to make, better choices when shopping and cooking foods. Also, simple recipes and grocery shopping guides are provided to inspire patients to eat healthier and more plant-based meals. In terms of exercise, recommendations were based on one's fitness level and motivation and their ability, of course. Patients were asked about activities that they actually enjoy, not necessarily exercise, but, movements. So, yeah, that was the main approach here in exercise. In terms of stress, as necessary, each patient had a discussion about various ways to relieve stress. It was mentioned to several patients that they appeared to need professional care from a mental health expert. Also, we talked about their social relationships and how involved they are with family and friends and community. It was advised to get involved in social groups, volunteer work, and other sorts of networking. So some of the lessons learned, as I previously noted, the patient and practitioner both need to dedicate the time to lifestyle adjustment. And it takes multiple visits to implement incremental change and maintain these new routines and establish, goals. So it is a process, as we said, and we need to always tell the patient that it's okay if they encounter obstacles or any setbacks, and we're there for troubleshooting and, recognizing these obstacles and creating solutions that, they can really implement. So there were limitations, of course, for in this project. As I mentioned, the time constraints, they prevented me from having frequent visits with the same patient. So, that halted the progress of behavior change. And also the clinical atmosphere was a little constrictive because each patient only had 20 minutes with the doctor, and then they waited a little longer to talk with me. So, that could affect their schedule and obligations. So it's not a long-term approach. So for recommendations to improve, this whole project, or, to improve the patient population's health in general, a role of a health coach or a preventive care professional who can plan individual visits with patients and have sessions that can spend, focused on lifestyle behavior change is necessary, in my opinion, so we can help improve our community's health. And I had many learning experiences over the course of this assignment. One included the significance of having strong leadership abilities to operate a clinic. By treating his employees well, Dr. Kazi set an example for what a good leader should be. So a leader needs to be a mentor and encouraging, advising their staff, maintaining a high level of standards and ethics. Of course, we always need to listen to our patients and take into consideration, their feelings and their circumstances when applying these lifestyle behavior changes. In conclusion, this applied practice gave me an idea about what I want to do career-wise. I would like to help patients directly in the clinical setting. The primary care setting can be viewed as, professional and trustworthy. So I believe incorporating some form of lifestyle counseling and health coaching in this context can have a great impact on the health of patients. So as a result, I'll be able to communicate with patients who have various experiences and backgrounds, which is really stimulating in my opinion. So this was my experience, and here are some of the references. And if you have any questions, I am glad to answer.
I will start with the first question. Do you think, well, good presentation, I appreciate that.
Thank you.
And is there a perspective for a job with that doctor there?
Well, we talked about that. Yeah, he really liked what I do, and yeah, he has some, ideas about what I can do in the future. So yeah.
That's great.
Mm-hmm.
Anybody
It is
else?
exciting.
Dr. Beeson has a question, I think.
Okay.
Go ahead,
I
Dr.
can't
Beeson.
see.
You're on mute, Dr.
Oh, yeah, I forgot that. I hear from a lot of people that they get frustrated when the doctor has dozens of appointments in a single day, meaning they only have 5 or 10 or at most 15 minutes to interact with the patient. They really don't have opportunity to ask questions and have a dialogue with their healthcare provider. Do you see any way, a good way to change that so that the patient can have serious time in a conversation with their healthcare provider?
Yeah, that's a good question. As I said, it's really limited, the time that the patient has with their doctor, and they can't cover everything. So I think this is where our role comes as preventive care specialists or health coaches. If I don't know how to combine, having a separate appointment maybe with the patient, so we can really sit down and talk about their goals and whatnot. But it's really hard for physicians, talking from an experience. My husband's a primary care physician as well, and he says that it's impossible, to give these lifestyle recommendations and really listen to every concern the patient has and discussing it with them. So I think we have a big role here.
Yeah, good.
Yeah.
I just wanted to follow up, and I didn't really have a question, but it sounded like that was a good learning experience for you. And I just wanted to also say that it's always great when you have and when you work with other health professionals, such as primary doctors, who value lifestyle and the need for lifestyle education and lifestyle medicine. So, if you can find and collaborate with other health professionals, whether it's a doctor, a physician, a nurse practitioner, even a PA, that understands the need for lifestyle education for chronic diseases, especially if you end up going into being a clinical preventive care specialist or nutritionist or lifestyle educator, that's an important thing to consider.
Yeah, I agree. Yeah, not everyone is leaning towards, lifestyle medicine, especially that maybe, prescribing medications is more, profitable. But yeah, I think this is the way to go in the future.
If you could just convince people that it's cheaper to keep a person well than to make them well once they're sick. That's hard. That's a hard road to go.
Exactly.
But this was the original plan for preventive care specialists. I mean, today they are more diverse, but in the beginning, that was the main thing. Preventive care specialists working side by side with doctors to do this comprehensive lifestyle approach that doctors do not have the time to do.
Yeah. Well, this
Any
is
other
exciting.
question from the audience?
Yeah, this is Orvin. How do you do? Thank you for your presentation. I'm one of the old-time DRPHs that started way back when. And I noticed that one of your examples, you talked about the hypothyroid patient. I have a soft spot in my heart for the hypothyroid patient for working with 7 years as a clinical health educator in the Native American population, where a large proportion of our patients had genetic predisposition to hypothyroidism. And what I want to emphasize with you, for whatever it's worth, that through the years I have found that it's incredibly important to develop that strong partnership with the physician when you're dealing with the lifestyle intervention for hypothyroidism, because it's just my experience and working with research in hypothyroidism from Cedars-Sinai, that we all have to remember that this disease is cyclic through the year. And so one of the first things I would do is I would look at their record and I'd see if the physician was modifying the dosage and different types of medicine by time of year. And that gave me a little clue as to how the clinician was responding to that particular patient. And it helps us remember how to intervene when one dose might have been really good in April and it wasn't really good in December, etc. Just a little nugget from many years in the field. Thanks.
Thank you. Yeah, my mom and sister have hypothyroidism, so I'm well aware of these
Okay, you certainly
frequent
know.
adjustments. And yeah, it's really hard. So thank you for bringing that up.
Yeah, well, sounds like you have a command of it. Well done.
Thank you.
Okay, guys, thank you very much. Thank you, ABRAR. It was an excellent presentation and excellent experience for you.
Yeah, well done.
Yeah. Now we are waiting
Thank
for ABRAR to go to the next phase and do her
Yeah,
final project.
hopefully. Working on that.
Yeah.